This is Jenny, and I'm going to show you how to use the yoga tune-up balls to work on your IT band. I call this one the candy cane because it kind of curls around and ends up in the same shape as the candy cane. So you're going to start with your ball, and it's going to go on TFL, which is not your hip flexor, but just behind it, between your iliac crest and your greater trochanter. The ball goes there, and you do a side plank on it. Let your hips drop down so that it feels some weight. You can roll your hips forward to follow those muscles like you're stripping. And you can also kind of push with your feet to cross fiber friction. You're kind of rocking against the grain of the fiber there. And you're going to curl around, tilting your hips back or rotating back. Maybe you're just stripping, or maybe you're still bouncing as you lean out around the edge of the greater trochanter until you're eventually almost sitting on it and then reposition. So I'm not right on top of it, it's kind of pushing the lip of the tissue out this way because I'm trying to get to the IT band and help to separate the IT band from the connective tissue that kind of ties into the hamstring and vastus lateralis. So what we're going to do is some sustained compression. You can find a really good spot where you really feel the tissue lifting and rock your leg in and out. When you laterally rotate your leg, it's going to push harder. When you medially rotate, it's going to be a little bit lighter. If you need more pressure, just tilt your hips and get your body more on top of it. And if you need less pressure, take it away. And you're going to do all of that the whole way down towards your knee. You can also contract and really squeeze every muscle possible and then relax it, especially on tender spots. It's going to do a lot of good in retraining your body on how to handle this exactly. To pin and stretch, you might just find a good moment where it's lifting and then lean forward. And it's not exactly stretching that area, but you're still lengthening the tissue possibly.